Hello guys, in this video we will going to talk about the influenza virus symptoms. We will going to talk about the symptoms of the influenza virus. Okay, so there are two main strain that infects human: influenza A and influenza B. Most of the cases during that influenza infection, they do not develop any kind of symptoms. That means some of the people are asymptomatic, but the people who are symptomatic, they develop symptoms due to the stimulation of the innate immune system to produce pro-inflammatory cytokines. Okay, and it recruits a lot of inflammatory cells to the lungs. Okay, that means our innate immune system, innate immune system, IIS, stimulates to produce pro-inflammatory cytokines. These pro-inflammatory cytokines recruits inflammatory cells to the lungs. That what causes the sudden onset of some constitutional symptoms. Constitutional symptoms means that is normal in most of the disease: fever, chills, myalgia, headache. Respiratory syndrome, because remember the thing is going on in lungs: cough, sore throat, and rhinitis. And these two, you know what, are the standard symptoms. And in case of people who have developed complicated syndromes, you can see otitis media, you can see sepsis type of syndrome, you can see sinusitis, you can see pneumonia. Among them, the pneumonia is due to influenza and bacterial superinfection. Okay, remember, bacterial superinfection is a situation that occur in most of the viral respiratory illness. Okay, but when this bacterial superinfection is very common, it's very common in case of the influenza. Okay, bacterial superinfection includes bacteria like staphylococcal aureus, especially our medicine resistant staphylococcus aureus, that can create severe necrotizing pneumonia, along with streptococcus pyogenes and streptococcus pneumoniae. Okay, so that is the concept of the symptoms of the influenza virus. Some of the people are asymptomatic, we are not bothered about them, but the people who have developed symptoms, that may be due to the stimulation of the innate immune system, which produces pro-inflammatory cytokines. That pro-inflammatory cytokines recruit inflammatory cells to the lungs, and that causes sudden onset of some constitutional symptoms like fever, chills, myalgia, headache, some respiratory symptoms like cough, sore throat, and rhinitis, and some complicated symptoms as well. For example, sepsis type of syndrome, otitis media, sinusitis, and pneumonia. These two are the characteristic syndromes. Okay, and this is only observed in case of people who have developed complicated illness. Okay, so pneumonia can be occurred by only influenza, but in some cases along with bacterial superinfection. Bacterial superinfection is a very common situation in case of every viral illness, but it is most commonly in case of influenza. Okay, so bacterial superinfection include bacteria like staphylococcus aureus, MRSA, streptococcus pyogenes, streptococcus pneumonia. Okay, so that is the case of symptoms of the influenza viruses. Okay, so we are wrapping up this video here. In the next video we will going to discuss about how you can diagnose the influenza virus. Okay, so thank you for listening to this class.